A Doctor of Nursing Practice degree prepares the graduate to use evidence-based practice to initiate practice change initiatives at the bedside, in the hospital, and in care delivery. So it's more than focusing on the care of one individual patient, but rather a population of patients. It may be delivery of a new care model or a quality improvement project, so they can look at the big picture and how to affect patient care and outcomes.
My project is Attitude, Beliefs, and Perceived Barriers to Advanced Care Planning.
I think the DNP is actually the highest level of training where nurses can really focus on what is the best evidence for nursing practice. That's what we need to be all about, is what is that best evidence? What should we be doing and what shouldn't we be doing? Those are enormously complicated questions, and it requires a healthcare provider who's had frontline experience in caring for patients, but also has the training to really dig into the evidence and create new knowledge around what we really should be doing at a time where resources just are no longer plentiful and have to be used ever more judiciously.
It's exciting to think about what Doctor of Nursing Practice students may be able to do. Many of them don't change employment, but what they're able to do within their organization is different. They are different. And so that they can initiate change, they can make a difference within their practice and within their organization in a way that they couldn't before they had this degree.
My name is Brian Pollock. I'm a first-year DNP student. I'm a nurse practitioner at Vanderbilt. I work primarily in the adult outpatient setting, psychiatry, so generally get up in the morning, go to work, go to the gym, go home, and it's dinner, get the little one to bed. So as far as fitting schoolwork in, it does mean less time with family, less time with recreational activities. I haven't taken a bike ride in a couple months at this point. For me, I get the bulk of my studying done on the weekends. I think if it weren't for that, I don't know if my wife would put up with it, so definitely time for all of it. Have to work to make sure you allow time for everything that you need to do.
You're a full-time employee very often. You may be a full-time or a part-time doctoral student, and you're a full-time family member, and you've got to think about how you're going to make that work for yourself. But there are some advantages to our program in that we offer a distance option, that while we have face-to-face time with students on campus once a semester, they complete the rest of their work in the convenience of their home or their work environment when the time allows for them to do that. And even though we're a distance program, and students are only on campus with us face-to-face once a semester, we really develop a community so that students have a sense of belonging with each other and belonging with the faculty. And even though, like I said, we may not be in the same place at the same time, students really can access faculty and have that support.
I work at a liver practice, and I took an interest with liver cancer, or hepatocellular carcinoma. This is a very aggressive tumor. It has a high mortality rate. However, if it is detected early, that can decrease the mortality rate. So because of that, people who pose a risk for developing hepatocellular carcinoma should be screened every 6 months. So my project was to look at our practice to see how well are we screening these patients. The value is to improve practice wherever you are and to use the things that you have learned to better the world as far as healthcare is concerned.
My project was an educational project, and I created a curriculum, a course, if you will, designed to train anesthesia providers in the care of patients who are undergoing obstetrical care. Data is important, and hopefully one can generate data, but my real love is the practice. My real love is making people's lives better. And so this offered me a really very deep way of doing that, based on evidence, based on research. This is where the rubber hits the road for me. This is why I did this. This is not some ivory tower notion. It was born in my work in Sudan. of women walking 4 days from a village hemorrhaging, and I'm there to do what I can to save them. And I thought we can do more to train the people who are here to do this.
Good morning, graduates. We are assembled today to honor your personal achievements and are pleased that so many of our graduates, their families, and friends have been able to join us on this beautiful day in Nashville.
I would say that any advanced practice nurse that's interested in improving themselves, improving their practice, improving the quality of care they give, improving the lives of their patients, would want to choose this educational experience despite the hardships, despite the financial investment, time investment, that it really will make a difference. It will really improve, and it will make your practice much more relevant in this in the healthcare system when you have the skills that the DNP brings to you, the care provider.
All of the studying, I just feel like I've accomplished this, that I did it. I would not change it. If I had to do it again, it's hard, but I would do it again. Without a doubt.